It's bad.
Nobody knows who Gage's aunt is.
CR is better, just they'll situate it aside. You kind of have to keep going. They won't tell you crap.
You got all
Yeah, you just got all of them.
Welcome, COSEMT. Part 3 of obstetrical emergencies. How did you pronounce this? Go ahead. What? And now you changed it.
Oh, spina.
You said spina bifida.
Spina bifida.
Then we learned about spina bifida.
I don't know what's spina bifida.
I should put a pet cemetery scene here, but I'd probably get fired.
Oh, the one with the rock?
No, the sister-in-law.
Spina bifida.
We're all
Spina
adults.
bifida? Yeah,
You gotta go by the Roman noodle. You gotta go by the Roman noodles. SB, the Roman numeral for that chapter. So spina bifida is a very unfortunate birth defect. Where the spinal cord and vertebrae is born outside the skin. Yeah. So what you do is maintain body temperature because they will lose heat. Moist sterile dressing. Oh, that's all, huh? When we go to pediatrics, we'll do more on that. And special patients. Any questions?
The Mormon sterile.
Did you say keep them Mormon and sterile?
Warm and
Oh,
sterile.
warm and sterile, yes. Sorry, I misunderstood you. I was like, what?
No.
All right, miscarriage, also known as spontaneous abortion. Please don't ever call it that. Ah, I got to clean up my hand for it. Okay. So this is delivery of the fetus before 20 weeks. Treat mom for shock, transfer to the hospital. There's nothing you can do for the fetus. Bring tissue to the hospital for a DNC. Any questions for pathology? All right. Oxygen, treat for shock, safe rapid transport, supportive care. Make sure you wear BSI. BSI should be first, not last. I didn't make the slide. I stole it. Any questions? Twins are usually smaller than single infants. Only case there was Arnold Schwarzenegger and Danny DeVito.
Yeah, baby too.
They can have babies.
Arnold Schwarzenegger.
And Danny DeVito had a baby?
Oh, I didn't know they were doing that, baby.
No. I don't know who that one is. And I've actually never seen twins. I just know they started it. Delivery procedures are the same. You just have to do it twice. Any questions? Yes. No, they don't come out at the same time.
One question.
Oh, okay, go ahead.
You said one or two placenta.
There can be one or two, yes.
And what is it like? Is it most likely two or most likely one?
I don't know. Which one is more, what is more common, paternal twins or identical twins? Yeah, so it'd be two. As they have separate placentas, whereas identical twins generally share the same placenta. As far as I know. But I may just be completely full of it, because I don't know why I know that, but that's what I was told somewhere. Any questions? It's plausible. Any other placenta questions? All right. Let's see what we got next. After twins, addictive mothers. Oh, I thought you were coming to talk to me. All right, delivering to an addicted mother. Now. If they're addicted to social media, that's one thing. If they're addicted to narcotics, the baby's probably gonna have some type of CNS depressant, most likely or respiratory depression. Low birth weight. And will likely need immediate care if you know the mother's addicted prior to delivery. You should prepare for that. Any questions? Anybody take photography? That's called forced perspective. They hold the one baby farther away to make it look like a premature baby, so it's smaller. Closer to the camera, it looks bigger. Forced perspective. Any questions about premature implants? Any questions? Fetal demise is also very unfortunate. This is after 20 weeks. And the baby's delivered with obviously dead. Usually a skin blister, slothing, very dark colored. This tissue's all necrotic. It's the baby's been dead. You don't try to resuscitate that. Any questions? No questions on fetal demise, huh? No, I don't have pictures in the games. Delivery without sterile supplies. Well, if you're on duty, you should have sterile supplies. But if you're off duty in a bomb shelter in a third world country, you may not have sterile supplies. So what should you do? Use clean sheets and towels. And try not to cut and clamp unless you absolutely have to. And keep the placenta at the same level as the infant. I got nothing to add to this one. Any questions? I have a hard time picturing being in this situation, but you never know. Yeah, I thought, well, everybody dropped. No. Let's just be daylight savings time. All right, gynecological emergencies, we already went over. Any questions? All right, let's go over more delivery and stabilization. Make sure you guys have this down for test 5, which is Thursday. I'm just kidding, don't show up for.
I was like, what, since when?
Yeah.
Exam 5 is Thursday for all of you who don't read your syllabus. All right. Let's see what you guys have learned. You've been called to the scene for a 23-year-old woman in labor. 12 minutes away to the hospital. It's going to take you 5 minutes to get there. Any questions so far? What do we do first?
Inside.
And en route, we review triaging the labor patients, how to set up for a vaginal delivery, and what supportive care we're going to give that newborn infant. I also want to know if this is the first delivery. If it's not, how long was the labor of the first delivery? How many times have they been pregnant versus live births? And do they feel the urge to push? If they do, we check for crowning. If they are crowning, we prepare for imminent childbirth. Any questions? No questions, eh? Oh no, she's crowning. So we must prepare for imminent childbirth. So we break out the OB kit. And we want to know, is she having twins? What is she due? And when the water broke, was it clear or was it black and green? And what is black and green water called? Very good. That's what your OB kit should look like. You rip it open and everything goes flying everywhere. You're in a panic. But we don't panic. What do? Stay calm. If you conquer your fear, you'll conquer her fear. Questions? All right, get mom into position. And allow the head to be pushed out using gentle pressure.
What was that bottom picture?
Yeah, that's a position.
Really?
So his hands and knees.
Would we deliver a baby like that?
You could. That's how mom chooses. Some are actually doing it in the bathtub too, underwater. All right, nuchal cord. You have a 1 in 2 chance. But that baby having a nuchal cord, what do you do for it?
Unwrap.
Put your finger in there and wrap around the head and take it off. Any questions? Yeah, last resort is cutting. That's why you absolutely cannot get it around the head. What happens if it's wrapped twice? You have to unwrap it twice. What's it called? Double nuchal cord. And what is it? 4 times. It's a squared nuchal cord. Nuchal squared. Yeah. Not really. It's not offensive. It's a joke for that. No, kids. Don't pull the baby. Support the natural process. Any questions? All right, cut the cord in 2 places, 7 or 11. We don't suction the baby's mouth and nose unless it's really struggling. Then assess the apgar for potential resuscitation. This baby is born limp and lifeless with no respiratory effort noted. What do? First step is nope. Try and simulate. Dry, stimulate, warm. Then we assess breathing and heart rate. If it's under 100, what do? No, wrong answer. Ventilate for 30 seconds and reassess. There's a pyramid you need to know. It's called the upside down depressed newborn resuscitation. So always going to dry warm position, stimulate. Probably will always need oxygen, may need effective ventilation, bag valve mask, intubation, may need chest compressions, and then at the end, medications. What do you give for a depressed infant? Antidepressants. Any questions? It's a test question. I don't want you guys to fail test 5. And here.
They're tricking me right now.
Huh?
They're just tricking me. Right now.
Yeah. Just trying to scare me.
Yeah.
All right, BVM and newborns. Any questions about how to bag a newborn? Use an infant mask and an infant BP cuff. No, not a BP cuff. An infant BVM. Any questions?
Is that small?
Here?
Yeah.
The ambulance is absolutely. Ambulance has these real cool things called Braslow bags. This has got everything you need to treat a child. The first thing is you take a Braslow tape and you measure the child. Then based on the length of the child, it's the approximate weight. And it's got a color code for each like 2 inches. And then when you see that color, they reach the Braslow bag, and you grab that color bag It's got everything in that bag is already pre-sized for that infant, so you don't have to guess. Very smart. That's on every ambulance. All right. Ventilating depressed newborns. Any questions? Any questions about chest compressions? Disregard that slide. So a little over 1 in 10 kids are have respiratory distress at term. If they do, suction the nose and mouth, good picture. Any questions? I literally have nothing to add to that. Any questions? Disregard. I stole these from a PALS class, from a PEP class, which is an ALS PEP class. I've never re-edited the slides. So there's a good picture for how to massage a fundus. Any questions? Do not try to stabilize a newborn to a backward. That's the most ridiculous thing I've ever heard in my life. Any questions? No.
On says, is there gonna be a question on, could you stabilize it?
That had better not be a test question. If it is, I'm turning in my resignation. One second.
Just felt like dancing.
Any questions? Do not try to secure a brand new baby to a backboard. Use a papoose board, preferably a car seat. If they're compromised, you're doing CPR, you're not going to be putting them on a backboard. Any questions? Ventilate, do CPR if it's below 100. After you ventilate, or below 60, definitely CPR. Diesel. All right. Let's see what you guys have learned. You're dispatched to a woman in labor. What do we do first?
They're gone.
Scene safety. So it's the first weekend in September. Law enforcement is on scene. Scene is safe. It's on the floor of a bank. No robbers. What's next? Primary assessment. Nobody got the first weekend in September.
Everything.
Yeah. Just wasn't funny. Is patient severity critically ill? No. GCS 15, chief complaint is baby is coming. Her airway's open and clear. We give her a little supplemental O2, a little supplemental O2 for ourselves, keep us calm. Any questions? Yeah, what's next? Not on top of my game. Should Donald obey with the urge to push? Urge to push means delivery is probably imminent within the next what time frame? What?
That's what your
That's
slide
at 60 to 90.
said. No, it-
30 to 60?
Yeah.
I know it's changing the goals on me. It's probably always been that way. No allergies, takes prenatal vitamins. No past medical history outside of being pregnant. Last meal was last night. And she's been pregnant for 40 weeks. What's that mean?
Full term.
It's time. What comes next? Look at that blood pressure. Pulse rate's 120, illustrations are 20, GCS is 15. Her abdomen's distended. We check for crowning and oh, she's crowning. What do we do? Stay calm. All right. Disregard this. This is an old system that, oh my God.
Amazing.
That was a really cool system we used to have. It was like back when you had a TV show where you voted for the contestants with your cell phone. American Idol. And it was a free American Idol thing. So I put the question up, you guys had all voted on the answer and it would show coming across the screen. It was really cool. And nothing free lasts, so. Any questions about OB? All right, get ready for the next slideshow. Now we're gonna move on to one Kenobi. It's not right. I want to see how long you're gonna try. The one over there does though on the tape.
But you know the whole time I was in bed. Fucking look at it, stupid.
Most people had no idea my middle name's Evil. All right. Thoughts for the day. No matter what anybody else says, does, or thinks, that's on them. You need to always be the best person you can possibly be, as professional as you can possibly be. Because what they did, said, or thought is on them, not on you. You are responsible for your thoughts, your actions, and your words. And it truly is the only thing that you have control over. You're going to be working in emergency services. And even if you're not working in emergency services, bad things are going to happen. Bad shit happens all the time. Mistakes are going to be made by you and by other people. And they're going to make a lot of them. And so are you. But none of that matters, because what matters and what makes or breaks you is what you do after you've made a mistake. And those actions taken afterwards are good or bad. How's how it will work out for you. You always have choices. Any questions? All right, so we're going to learn about pediatric assessment management. We introduce you to your new best friend. Their name's Pat. You use whatever gender. It could be a he, could be a she. Pat's interchangeable. Pat's going to be your best friend for this presentation. So you're going to learn about how to care for sick and injured children. There's a lot of anxiety and stress in EMS on dealing with sick kids and injured kids because the reason why is you guys already have been practiced, tried and true, and have patient assessment down pretty damn well. You can walk in and do BSI scene safe as good as anybody. But you don't do kids very often. So it's almost impossible to be proficient in kids. The only people that are proficient at emergency child care are basically NICU and PICU nurses that work in university hospitals where the sickest of the sick kids end up. They're the only ones that really, really do it every day. So like in this class, we teach you guys how to do adult patient assessment and treatment over and over and over and over again. So you can't possibly get it wrong. And then when you go out in the field, you'll be treating those people every day and you'll sustain that as long as you're working full time and you're doing. But kids, you don't do very often. And there's a lot of huge differences. They're not little adults. There's a lot of different physiological things and things you have to know. So it causes stress. Also has its own whole section on the National Registry test. So you got to know your shit or you won't pass. Any questions? All right, moving on. So one of the big things with the pediatric emergencies is taking note of your surroundings. Your environment's going to give you a lot of clues to what's going on if the child can't tell you. Position of the patient, condition of the scene, and we're going to go over the flags of child abuse. I don't know if we'll get through all of them, but we're going to try. Any changes? All right, there's your new best friend, Pat. So anytime you have a pediatric emergency, you're going to use Pat with your primary assessment. You still want to make sure they have a good airway, they're breathing adequately, and they have a pulse, they're not bleeding to death. But you really want to use Pat right when you walk in the door. So their parents, what do they look like? Are they awake? Are they alert? Are they tracking you? What's their work of breathing? Are they breathing? Do they look like they're not breathing? Are they struggling to breathe? And then what's their skin color? Encapsulator refill. Those three things are critical. If one of those is positive on your assessment, you've got a sick kid. If two or more are there, you have a critically sick kid. If you have four or more positive findings, you don't know what you're doing because there's only three edges to a triangle. Any questions? I cannot emphasize this enough. Now, this is a fake picture, but it's also a good picture. If you have an unresponsive child, you have to secure their airway. Majorities of the medical deaths in children is lack of airway and breathing support. They have a giant big bobblehead. Or for burns, for body surface area, we take 4.5% off each leg. And where do we put it? On the head. Twice the body surface area of an adult. So when that head is unresponsive, it shuts off their weak little anterior airway. So the best way to prevent that is to get padding behind their shoulders, which lifts their shoulders up and puts their airway into a more neutral position. Any questions? That's why that's a good picture.
In pediatrics, and exactly up into where it's a child, but in the medical situation like this, the trackable, do you go to like teenage?
Could be. Yep. I mean, look at your patient. Do they look like an adult or do they look like they're still a kid? What are their features? Any questions? What is it now in California? 880? Can't remember. Huh? 10 and 100? It's crazy.
They want me in person.
So at the final, we're all chipping in and we're getting a Breguet, a car seat, a booster for the final.
I just need a booster, I don't need the classic.
Huh?
Right?
Yeah. Oh, we can get them on Amazon and have them deliver it to the classroom.
I just need one for the ambulance.
The guy who wants to.
Yeah, you use Polo, they don't make phone books anymore.
I know.
Yeah.
I had Philip.
If at all possible, you should secure the child into a car seat, preferably their own, and then secure that into the gurney. Any questions? Car seats are best designed for kids. They're engineered just for that purpose. If not, hopefully you have a PD mate, which is a child securement device that attaches to gurneys. Any questions? There's your vital signs you should be familiar with. You don't have to have them memorized. But you should be remotely familiar. I checked hundreds of text messages on my phone. Yes,
Why would adolescents 12 to 18 have less respirations than normal? And less-
because they have better tidal volume and don't need to breathe faster.
Okay,
Does that make sense?
yeah.
All right. So respirations, the trauma is the number one killer of kids. The number one killer of medical reasons for kids, though, is respiratory compromise, usually respiratory failure, and followed by airway obstruction. And if they're under 3 years old, remember, they're still going to be diaphragmatic breathers, so count the respirations on their tongue. They will see their belly. Any questions? Brachial pulse. Remember, do not check carotid or femoral. Check the brachial. The way you check a pulse is to push an artery that's close to the skin up against a rigid surface. There is no good cartilage in the neck yet on babies. That's why we don't ever check for carotids. Use the brachial because the humerus is already rigid. Any questions?
Did you potentially like do the normal like you like that on a baby too, or just?
Yeah, it's just a problem with the brachial is easier to access. And probably will get you accused of a lot less things than sticking your hands in the crotch of a child.
I'm
Any questions? Blood pressure, generally if they're under 3, blood pressure is not significant. Capillary refill is the key telltale sign. Any questions? Any questions about capillary refill? I'm sorry, Mr. Coates, I'm trying to make it as interesting as I can.
I slept horrible.
You slept? Must be nice.
I barely slept last
All right, kids compensate very well. They can be in compensated shock. The only way you're going to know is by delayed capillary refill. All their signs and symptoms don't change, even when they're in compensated shock. Only capillary refill time. That said, when they run out of compensatory mechanisms, then they drop quickly. Level of conscious drops, blood pressure drops, pulse rate drops, go into respiratory failure, they die very, very fast. If there is any change in the child's condition, we immediately repeat the initial assessment and we consult with Pat. Any questions? Pat is your friend. Again, pad behind the shoulders, get the airway into a neutral position. Any questions? What is that? You're correct, that's a tree. What do we know about trees? Everybody take botany and biology? What is generally at the end of those branches? Leaves. And what do leaves do for the tree? You don't know? They excrete oxygen, you take in carbon dioxide. Just like the alveoli. Then that travels down through the bronchuses to the trunk. So if you were to flip that tree upside down, it's a trachea dividing into two main stem bronchuses down to bronchioles, down to alveoli. It's exactly the same, just reversed. You'll never look at a tree the same way again. Any questions? Kind of cool. Any questions? All right. Remember, I just told you guys the majority of medical deaths in children, medical deaths, not trauma, are from respiratory failure. It's 4 out of 5. 80% of kids die not maintaining their airway and not properly ventilated. A majority of those happen to children under the age of 1 year old. Kids also have different spectrum diseases. What is common cold for a death on most outside. What is a common cold for adults can be life-threatening for children. Pediatric airway is smaller, softer, and more anterior and higher than the adult airway. And it is easily obstructed by their giant tongue on their giant bottle head. Any questions? Obviously, I'm just offending Caldwell. He's already in adolescence. Questions? There's all your anatomic considerations for children. Who silly's law will be on the test. It will also be a go home question. It's increased resistance to airflow. But only in French children. All right, Becca. You thought he was a French doctor. It's not gonna be a French. Thorax, their rib cage is also soft. So they cannot generate airway pressures to cough like an adult can. Same thing with their tracheal rings are not so bad. Oh, they cannot support those airway pressures. And they got little faces with little tiny sucking jaws. So they cannot support their airway. And they got a large occiput, which is medical for a big head. Any questions? No questions on the anatomic considerations for a disastrous pediatric airway? You should be terrified. Man, they just keep hammering today. No questions? Look at that. Is that gonna work well? Look at that airway. It's gonna go down that way and then that way. Here it doesn't move like that. Any questions? Not good. See? That's how you make an airway work. Any questions? What are the signs of respiratory distress? All those things, including torpor. Torpor is the beginning of respiratory failure. Again, this happens quickly, respiratory failure. Any questions? Carly was willing to model for us. So sternal retraction. So the sternum and the rib cage are still soft, they're not calcified. And there's no intercostal muscles yet. So they are diaphragmatic breathers. So when they go into severe respiratory stress and they're really having to suck air and pull air, trying to get the largest airway pressures they can, it will actually concave the sternum. It's called sternal retractions. Here's some videos of that.
Hi, baby. What is?
Is that diaphragm moving? The kid doesn't look that sick, count his respiratory rate.
Hi, baby.
Way above what it should be. He's not gonna be able to sustain that. Respiratory rate's about 80 to 100. And it's got sternal retractions.
Oh.
I know, that's terrifying. Look at his respiratory rate, it's like 80. Exactly. Exactly. That's the terrifying thing in children. That's why you gotta look at things like, that's why PAT is so important. Actually, refill and respiratory rates.
Hi, baby.
Is she exercising that?
Hi.
No, I think she's trying to interact with it.
Alrighty then.
So the problem is that kid's not gonna sustain a respiratory rate of 80 for 8-10 hours. She's gonna run out of glucose when they go on respiratory failure. He doesn't get some type of support. Bastards. All right. So after respiratory failure, One of the next most common things is foreign body aspiration. Kids love to put stuff in their mouth and choke on it. Buttons, beads, batteries, coins, food. It never stops. What is that? Well, first of all, someone's having to hold the kid still for an x-ray. Let's see, the hands are on the head. Yeah, it looks like a coin. Is that in the airway? Probably not. The airway's not that big. So it's not in the airway. What would it be in? Yeah, the esophagus. So, if you don't have calcified rings of your airway, and something's pushing on the esophagus like that, would that be a problem for the airway? Absolutely. Yeah, I believe that's a dime. Could be a nickel. How about that? That's a popcorn kernel inside of a bronchus. Kid inhaled a popcorn kernel, eating popcorn too fast. Best one I ever saw was down in Reading. After a kid took a 7-year-old took a blow dart, put it to his mouth and inhaled, and he sucked the dart.
Oh.
You're supposed to inhale before you put the blow dart to your mouth, kind of like doing lighted shots. And he inhaled the blow dart down into his left mainstream bronchial. You can see the feathers and everything. Yeah. All right, URIs you need to be familiar with. URI stands for upper respiratory infection, which is a broad spectrum of things. They're mostly viral, very few of them are bacterial. And again, with kids, they don't look that bad until it's really bad. And there's not a whole lot you can do in EMS about it outside of transport. Humidity, if you're waiting for an ambulance, turn a shower on hot, get a lot of steam going. Humidity helps. Fever control, not much you can do about that in the field. And reassurance. Come on, little Charlie, you're okay. Don't say you're okay. Any questions? All right, epiglottitis, we went over that in adults. It is much more prevalent in children. When the epiglottis becomes infected, it starts to swell, block the airway. It can be viral, it's mostly viral, but it can also be bacterial. Telltale signs is wheezing, leaning forward, stridor, and drooling, and a fever. Know that for your test questions. Oh, look at that. I think you guys already watched this, didn't you? Okay. So that's almost completely obstructed. Not a whole lot of air passing through there. This can be fatal. And again, don't put OPAs or MPAs in because that last little bit of irritation cause that epiglottis swell and completely obstruct the airway. 1 in 10 kids, if they don't get into a hospital and get put on a ventilator, dies. But only 1 out of 100 does. They get on a ventilator. Biggest risk years are 2 to 4 years old, but it can happen at any age. Any questions about epiglottitis? You don't want this. It's terrifying. No questions? What comes after epiglottitis? Group. Oh, guess not. I was wrong. Oh. Remember, pad behind the shoulders. I don't know about placing tape across the kid's head. You gotta put an oropharyngeal in if it's epiglottitis. But if it's not, you need to secure an airway, it's a good thing. These are horrible photos. Do not overventilate. Any questions? Make sure you have the right size BVM device. There's infant, child, and adult. Any questions? I've never seen a child that sick with their hair perfect and their clothes don't work on them. Any questions? Now we got a croup. The croup is a viral infection below the vocal cords because that seal-like bark. And epiglottitis, and of course, FBA, foreign body airway obstruction, FBAO. What are the signs and symptoms of severe pediatric respiratory distress? Decreased or absent breath sounds, stridor, retractions, and difficulty speaking. And if they get it completely obstructed, they won't be making any sounds because they don't have any air to make sounds because they can't move air because it's obstructed. And they'll turn blue. And then they'll lose consciousness. Any questions? So this isn't nearly as good as it used to be. This is a kid that inhaled a horn. But unfortunately, Instagram took the sound off every time you exhale and go, oh. But apparently, he felt it was cruel. Millions of people laughed at this poor little guy. And it is sad because he's tired. You can tell he's going into fire. You can see it in his eyes. He's just getting tired. But unfortunately, they killed the sound on it. No, I'm not going to lie. Not nearly as effective without the sound. Oh well. This one? I think it's way too big there. Okay, that's not it. Well, YouTube is just no fun. Oh well, back to work. So, if they're breathing, let them try to expel it. If they're not breathing, you can try back blows. They go unconscious, lay them down, and it is chest compressions, rapid chest compression, trying to compress air, pop out the airway obstruction, trying to get air compression like a air piston. Make sense? Any questions? What's wrong with that picture? What's he doing wrong? Exactly. Airway's not in position. Needs to get the airway in line. He's not gonna ventilate that very well like that. Neither one of those two are getting an Oscar for acting. Any questions? Abdominal thrusts don't work that well on child, or you can try, but you know, again, they don't have the airway pressures to force that. It might work though. Do not do abdominal thrusts, chest compressions. Any questions? So remember, when it's neonatal, which is a newborn baby, we want to use the inverted resuscitation triangle. Any questions? If you were to go to a museum, that's what neonatal resuscitation equipment looks like there. Any questions? Any questions on resuscitation? Remember, if it's a meconium baby, call the hospital early. They're gonna need a full management team, be prepared to suction, be prepared to ventilate. These kids have a really rough time and have a high mortality rate. Any questions? Medical cardiac arrest in children is 4 out of every 5. Respiratory compromise. Any questions? What do we do? Timmy, are you okay? Cat, shake and shout. Don't shake and shout. I have nothing to add to that. Any questions? Again, you have to position the child properly. Positioning is everything. Any questions? Breathing. Look. Listen. Feel. Provide rescue breathing if needed. What's wrong with that? With that bullet? Any idea? Do you remember what a Selleck maneuver is? No one remembers what a Selleck maneuver is? So when you grab the cartilage, grab and crank up their membrane, and crank up their cartilage, you push it in, it collapses the trachea so you can ventilate. Well, why would that not work on a child?
The rings are
The
full.
rings are calcified. Who the hell put that in there? Not me. One of these days I'll take it out. Circulation. Check for pulses. Anytime in a child their heart rate is below 60 and you're ventilating, you need to start compressions. Not adequate.
When?
Below 60. Hypoxia equals bradycardia. Respiratory failure is smooth muscle relaxation, losing consciousness, bradycardia, all the signs of respiratory failure.
And that goes until puberty or service.
Actually, that's the results too.
Okay.
They don't generally get as much as the bradycardia, but they get the smooth muscle relaxation, falling SpO2s, decreasing level of consciousness. There'll be test questions. Any questions on infant CPR?
Question, if I know where you do a video of a cop that pulls over somebody because they're speeding.
Uh-huh,
It was Chip.
uh-huh.
So Chip.
Does he back blow? Gets it out, holds him upside down and back blows him. Good job. Send it to him. Email it to cosemt@gmail.com. I could use that video until YouTube takes it away. This does not meet our community standards. Nothing I do meets our community standards. All right, any questions about infant CPR? One thing you guys do need to know for the test is most infants are not strong enough to give adequate CPR. Any questions? You look confused. It took you that long.
No, I got it, I was.
Any questions about infant CPR? Agreed. Oh, look at that guy. Look how sick he looks. What's wrong with that picture? It's airway. And his color. If his color's that good, he does not need CPR. And you also don't do two finger compressions on a child that age. That would be bottom of your palm. Horrible pictures. There you go.
Just one hand, yeah.
He's actually alternating. Push one hand on the chest, one hand on the head. Chest, head. Just kidding. It's a joke. Any question? Gallows humor. You guys are laughing about child CPR jokes.
We've been making too long.
Yeah, it's only been a month. Any questions? Huh? Yeah. Maybe 5.
Oh.
Children under the age of 8 should not use AEDs. Actually, it's not true. Children over the age of 8 should use adult pads. 1 to 8, you should use the pediatric pads. And generally put them on front to back. Any questions?
I do have a question actually. With the AED pads, if there's like a gunshot wound where your pad would go, it doesn't really matter if you move it like to the other side, does it?
That's a very good question.
Because when I did my CPR.
I'm trying to
training-
picture that.
When I did my CPR training, he said that it doesn't, I didn't have this person though, so.
Well, the
my
AED
guy-
pad would make a good occlusive dressing. But it wouldn't have a one-way valve.
Yeah, and you would just put it over it? Cause he said it doesn't matter where you put them, as long as they're like opposite on the front and the back.
Yeah, but it gotta be, the heart's gotta be in between, because otherwise it doesn't depolarize the heart, which is the whole point of the AED.
Yeah, but like, so could you go like left side and then
Yeah, you
right?
can put
or
it,
vice
you can put
versa?
it apex, sternum to apex, yeah.
Okay,
But the good news is a gunshot wound to a child's chest is probably not gonna be VFib, it's gonna be PEA or asystole. That's the good news. Kids are very rarely in ventricular fibrillation. Any questions? Trauma. You guys ready to learn about trauma? All right. So, as always, especially with head trauma, if they're unconscious, airway is going to be one of the biggest things, airway compromise. Any questions? A Papoose board. This kid gets sick a lot.
Still smile.
He does. And it's good skin tone and color and morning drive. So papoose board, we have 3 of them in there, if you guys want to check them out. We'll practice putting brochet in them. Anyway, it's got natural padding, puts the airway in the position it's supposed to be in, with specialized restraints to restrain children. Very good spinal mobilization device. So if you don't have a papoose, and especially the smaller children, their own car seat is a great idea. That's actually a good picture. This with a terrified, very unhappy child. Any questions? I don't know where Balto County is. I'm assuming it's a county with sled dogs, but don't ever do the short board, take a child out of a car seat, secure them in their own car seat. That's the most ridiculous pictures I've ever seen in my life. Don't do that. So how do you know if a child's having a respiratory emergency? Nasal flaring, lunging, respirations, use of accessory muscles, retracted rib cage, all the things that you're looking for with PAC. What do we do when they're in respiratory distress? O2 transport and keep them sitting up. Any questions? So kids go into shock from fluid loss, whether it be diarrhea, bleeding, late stage sepsis. The big thing is going to be, you're going to notice first is decreased capillary refill time, extended prolonged capillary refill time. Late stages is going to be mottled skin, decreasing level of consciousness. Here are your questions. They're going to be next to dead when that happens. Any heart rate above 160 is bad. Capillary refill is always going to be bad. Delayed capillary refill, sorry. Any questions? All right. Any questions? Seizures. Biggest problem with seizures in kids. Airway compromised, the post-ictal state. Remember, their head's twice the size it should be. Well, not twice the size of an adult in perspective. For the anterior soft airway, it's very easy for the airway to become compromised in a post-ictal state. Any questions? Febrile seizures are common in children under the age of 6 years. Any questions? Does not mean that they're an epileptic. I almost said epileptic.
They come up from ages what?
Below the age of 6. Any questions? What to do with the child after they seize? Stay out of their way. As soon as they stop, secure the airway. Be prepared to ventilate, supplemental O2. Any questions?
Outside.
Take cooling measures. For the Siskiyou County from end of September till about May. Yeah. That works.
But for how long?
Yeah, you don't want to cool them too much. I mean, so they don't feel warm anymore. They're not breathing adequately, start BDM. They're not perfusing adequately, start DPR. So dehydration, the next most common thing after respiratory failure. Children can get GI viruses that cause them to have such massive diarrhea, it can dehydrate them. Things you want to ask. When's the last time they had a wet diaper? We should be getting 6 to 10 of those a day. They haven't had one all day, that's a problem. How many fluids are they taking in? Are they taking in normal intake? What was their child's weight before they got sick? And are they acting normally? Any questions? Emergency care for dehydration. Says the ABCs, gain baseline vitals. Look for ALS backup if they're gonna need fluids. Any questions? Oh, it's an unresponsive child. All right, what is the mnemonic for altered level of consciousness? The same in children as adults. Remember the song? Oh, I didn't show you guys the song. AEIOU tips. Any questions? All right, let's see what you guys have learned. You're called to the home of a child who's had a fever for 1 day. Prior to your arrival, she experiences a generalized seizure, followed by a post-ictal state. What do we do first? Who's that scene safe? Who do we bring with us? Pat. Oh, look at Pat. They know everything. All right, airways open, no stride or respiratory rate's 25, that's good. Heart rate's 115, that's pretty good for someone that age. BP's 105, 65. And while you and Pat are looking at this patient, they seize again. So we let them seize as soon as they're finished. We suction their airway as needed, do airway placement, get them on oxygen, and have our trusty BVM ready to go and begin transport. That does not look like a 3-year-old child. Any questions? Any questions? So what can cause seizures? Fevers, of course, brain trauma, low oxygen levels, also known as hypoxia, severe infections, ingestion of poisons, low blood sugar, also known as hypoglycemia, other metabolic disorders, bleeding into the brain, which would be head trauma, or if they're an epileptic, not on their seizure medication. Any questions? We had a kid in Mount Shasta who, my God, by the time she was a year old, she was having so many seizures, they ended up like removing a huge part of her brain. She also had to have the apnea monitor because she'd have the apnea monitor go off sometimes 20 times a night, she stopped breathing. So the apnea monitor will go off, mom and dad would run there and stimulate and start to ventilate, and then she start breathing on her own again. But yes, so the answer is yes, you absolutely can. And it's very sad. Any questions about fevers? Cool. Generally, the fever's under 105, it's not gonna be harmful. Over 105 though can be really, really dangerous. Any questions? All right, let's try another one. We dispatched the home of a 4-year-old child, not acting right. With a caveat here, they were recently diagnosed with type 1 diabetes. What do we do first? Yep, and then who do we bring with us? Yeah. The airways open, no strider, respiratory 30, a little fast, not bad. But skin's moist and warm with an elevated heart rate and capillary equal times of 2 seconds. That's not good. And they're unresponsive with their eyes only opening to voice. So that's not. That's 2 out of 3 signs on Pat. What's that mean? Probably a critically sick kid. There's those AEIOU tips. That's in here, isn't it? Here it is. Where's the song?
You gotta sing it.
Huh?
Need you to sing this.
Oh, I'm not a performer. Here it is. Last semester's class did.
Trauma was being diagnosed faster than your mom was. Alcohol, blackout on the dawn. E for apples, be switching all dawn. Endocrine's whack, electrolytes fry. I for insulin, sugar roller coaster ride. Opiates and overdose, snoring real loud. Knocking in the nose and they're cussing in the crowd. Use uranium, kidneys went on strike. Smell of pain? Yeah, that's the type.
I've got a TikTok of it. Hunter Reginado did that.
No way.
Yes.
What you want to call? Yeah, texting Hunter about that.
As in Raptor or as in?
Huh?
As in Raptor or?
Yeah, it was his voice. No, it's AI song generator.
I know, I like it.
22 years of baseball.
Play that.
You seen that?
Just play that. Send me the SoundCloud, dude.
Swear to God, I had it in pockets. All right, who rode along on Wairika today? You? Your patient was septic
Yeah,
and you didn't take the proper VSIs with the septic.
I did too.
Oh, okay. They just told me to tell you the patient was septic.
What about the patient with the hip problem?
I'm not going back and forth. I'm teaching EMT class. What do you think this is? All right. Any questions on EIOU tips? We just did that. All right, so airway, oxygen. Any question on hypoglycemia? Kids have troubles managing insulin without question. If they're diabetics. Any questions? Any questions about diabetic ketoacidosis? Again, kids do have trouble managing this. No questions, huh? It's driving me crazy. I know there's a really good video on this. Problem is, I have way too many TikTok videos.
Feels like one of those nice, very nice things, study, you know, the thing.
Uh-huh. I hear you. All right. Now, that actually is a real picture. That's what a cardiac child looks like. They're beet red and they do not handle heat well at all. That said, I don't really support putting an ice pack on their face, but you should have them in a fan, cold mist, something to cool them. Should. I know it's here somewhere. And now it's driving me crazy. Is this it? Nope. Nope. Hold on. I'm just gonna send it to all you guys. Put it on the website. Oh, can't find it. So you guys need to learn the difference between hypotension and shock. There is actually a difference. Not all hypotension results in shock, especially in kids. And understanding the difference between compensated and decompensated shock, which I think most of you have down pretty well. And you don't have to worry about dysrhythmias because that's way outside your scope of practice. So remember, shock is inadequate perfusion to all distal cells. And a lot of times it's caused by hypotension, but not always. Any questions? Blood pressure, you can still have shock even with inadequate blood pressure. Any questions on the difference between compensated shock in kids? And decompensated shock in kids?
IBP was a sign of the competition.
No, low BP. It's that way in adults also. Any questions? Do not raise their feet. We found out that doing that causes them to bleed out faster. We don't want that. Is this it? That's one of them. Sorry. Need to do this at break time. Trying to make it more interesting for you guys. So Rashad, oxygen and diesel. All right, look at that kid. That's a real picture. So just using PAP, what do you see?
Eyes are dark.
Yeah, sunken eyes, probably dehydration, redness, got a rash, and looks lethargic. That's 3 days of vomiting and diarrhea. Airways open, respirations are 50. That's elevated. Is that a problem? That's a positive PAT sign. How about circulation? Capillary fills at 3 seconds, heart rate's at 180. That's 2 PAT signs. But appearance, they're alert. So 2 out of 3 parts of the triangle, yes.
Are all the signs of dehydration in pediatrics?
We just went over that. You want me to go back through the slides?
You know, right?
Delayed capillary refill time.
Yeah.
Tachycardia, your heart rate of 180. In kids under the age of 2, a dent in their forehead from the fontanelles collapsing, decreased fluid. Lethargy. That's all I can think of off the top of my head, and there's at least 2 or 3 more. Fontanelles,
For dehydration,
yeah.
isn't it like, they also should have at least 6 to 10 wet diapers? It's not urinating
Thank you.
enough.
6 to 10 wet diapers a day. When's the last time they had a wet diaper? Somebody took notes. So I don't know, what is the child's feel like? This is not good. We got 2 out of 3. That's a critically ill child. So we know they've had diarrhea, so we're assuming this compensated shock due to the loss of fluid from diarrhea. So we're gonna get them moving. That's about all you can do. You ready for the next one? Previously healthy 15-month-old presents with 12 hours of fever, an hour of lethargy, and a purple rash. That's not good. Who do we bring with us?
Yeah.
What are you guys thinking with purple rash?
I was thinking chicken pox.
What's that?
Is chicken pox? No.
Barney syndrome.
Say, when we.
Tap it out. Airways open, respiration rate 60, heart rate 70, with a faint brachial pulse and capillary with 4 seconds.
You get the rash from the fever?
The fever plays secondary to what's causing the rash. And they're not alert, their eyes open to pain, so all three sides of Pat. This life-threatening emergency. Decompensated shock. BVM, be prepared to do CPR. Any questions?
Do we know it's decompensated because they have all three sides of the triangle?
All you said triangle, the heart rate's down to 70, catheter refill time's 44 seconds, the VP's falling to 50 systolic.
Okay.
And they're unresponsive, well, the eyes open to pain, but yeah, that's. All those side symptoms equal decompensated shock. Ready for the next one? A 3-year-old found blue and unresponsive. Last seen 1 hour ago. And there's a bottle of clonidine next to them.
We're all seeing 3-year-old right now.
If I remember this slide correctly, it's a daycare center. It's an early childhood learning center.
What's called?
Clonidine?
Yeah.
Google it. It's a calcium channel blocker for blood pressure.
Oh, okay.
I'm pretty sure. You want me to look it up?
I know.
I think clonidine's for blood pressure. I believe it's a calcium channel blocker. Clonidine. No, it's not. Da-da-da. It's ADHD. It's meth.
It's.
No.
To treat high blood pressure, ADHD, and occasionally withdrawal.
Yeah, it's a calcium channel blocker.
Or anxiety.
I wonder why it says ADHD. Why would you use a calcium channel blocker for ADHD? And it's not actually not a calcium channel, it's an alpha-2 androgenetic receptor antagonist. So it's a lot newer than a calcium channel blocker. Who do we bring with us? Pat says, airways partially obstructed, respiratory rate's low. 15 and a 3-year-old, that's not good. Heart rate's 30. What do we do with the heart rate at 30? Ventilate and start CPR. Catheter time's 3 seconds, blood pressure at 30. Painful stimuli. So this child also has all three sides of the triangle. Open the airway, BVM, chest compressions. Diesel, any questions?
So even though they're alert to pain,
They're not alert to pain. Their eyes open to pain. If they were alert, we would be checking on unresponsive or pain.
okay.
Ready for another one? We have a 1-year-old, the history of congenital heart disease, and it's fussy. Somebody say something? That was weird. What does Pat say? Don't worry about this. This is above you guys. Not above you. I didn't mean that. That's a paramedic class question. This is above you.
What do we do for BLS support?
Yes. The BLS support is going to be oxygen and run. Run.
Are you doing ALS one? What are the
Diesel. Well, ALS can at least they can cardiovert them. They can do a synchronized shock. Try to bring the heart rate down, reset the sinus rhythm. Pretty rare to see kids with congenital heart defects. So, I mean, we see them more now than ever, but it's still reasonably rare. Almost a break time. Respiratory emergencies. What's important to know about that? It's the #1 killer of children outside of trauma. All right, we got a 9-month-old infant with difficulty breathing and fever. Who do we bring with us? Oh, where's Pat? There he is. This is weird. Come on, there we go. Respirations of 80. You ever seen that before? No? Nobody's ever seen that. Sanchez, you ever seen that before? No. I swear to God, we just watched the video of a child with respiratory at 80. Sternal retractions. I think we even discussed it.
Well, I thought you like real life, real life.
Yeah, I thought we were about in real life.
Yeah,
Really?
I seen it. You know.
Killing.
Yes, I have seen that.
Yes. On videos.
Not there.
All right, heart rate's 180. A little high,
Yeah.
way too high. But capillary recall time's normal. So we have how many sides of the triangle? Just one. Breathing. Yeah, but his capillary recall time is normal, so it's still compensated. It's not good. Look at that sternal retraction though. Ooh, baby. I don't know why there's a car antenna across the safer. Oh, wait, that's electrodes. This is a very old slide. I'm still using steel wires. Good slide. Respiratory distress, see the increased rate of breathing as we get into respiratory mechanisms begin to fail. SpO2 fails, they start becoming altered, smooth muscle relaxation, bradycardia, and then they just quit breathing altogether. They screw it, I'm done. So upper airway obstructions are generally stridor, which is a high pitched inspiratory wheezing or whistle. And lower airway obstruction is generally considered wheezing, which is a high-pitched expiratory whistle. And fluids of the lung is called coracles, also known as rales. Any questions? What do we call lower airway diseases? Your eyes. All right. Asthma is very common, followed by a foreign body obstruction, followed by bronchiolitis. Any questions? Asthma dude's hair. Probably.
For like 5 over.
Any questions? All right. Respiratory failure, again. They go from tachycardia to bradycardia, higher respiratory to lower respiratory rate. They start losing consciousness. They get the head bob. Any questions? Be prepared to support the airway, support the airway.
What's blow by oxygen?
Blow back. I'll show you. Blow oxygen, you have oxygen blow by, and they breathe it in. So. You have the oxygen line in the back of a teddy bear. When it blows by, you go, oh, don't you love the teddy bear? And then the oxygen blows by and they breathe it.
Oh.
It tricks them into getting oxygen. So you try to put a mask on their face, like a yeah. But if you do something like this, blow it works very well. Those are actually nebulized bears. They put medicine in them. And nebulized up in this. They hold the bear close to the face and work very well. All right. Go to break. We come back Thursday. We'll go over swallowing match Super Bowls.
All very. So I'll be back on Thursday.
Yeah.
I said go to break.
Rest of the night.
No, I said go to break.
You said go
We'll be back at 8 o'clock to do
Thursday.
skills. And we'll talk about choking on Super Bowls on Thursday.
That's all I got.
All right. See you Thursday.